Hi, everyone. It's Dr. Ozzy here. Welcome to the More Than a Pretty Face podcast. I'm here to answer all your questions about skin, health, beauty, and wellness, and take you behind the scenes in my practice. If you have any questions you want me to answer, send me a DM on Instagram at Skin by Dr. Ozzy, and I'll be sure to answer them on the show. Now, let's get started. Hi, everyone. Welcome to the More Than a Pretty Face podcast. Joining me today is Dr. Terrence Keaney, and he is more than a pretty face. He's joining us from Washington, D.C. He has published numerous peer-reviewed journal articles, specializes in injectables, regenerative medicine, as well as body contouring. And today he is joining us at Masters of Aesthetics, where he's going to be talking about male aesthetics in particular. So welcome.
Yes, thank you so much for having me.
Yeah, so nice to see you again.
Pleasure.
I think the last time I saw you, we were at a conference in Miami, I believe, right?
It's been a while.
Yeah, it's been a while, so it's good to catch up and talk with you. Well, I want to start with, I'm sure you've seen this all over the place on filler fear. Patients are coming in and they're like, I have this hollowness or I have this, but I don't want to do filler. I want to do just PRP or, PRF. And so are you sensing that too, that people are so afraid of fillers?
Yeah, I mean, we see it all the time. And I think the question is, why are we seeing it now? Why is this discussion happening when fillers have been around for decades? And I think what's happening is, particularly on social media, you see people that have overdone filler, which is has always been around, but I think the attention that some people get when they have overdone it with filler is amplified on social media, and then everyone assumes that's a normal outcome with filler.
Yes.
And understanding that those are anomalies. And I guess the bigger question is, why do we see those kind of what we call facial overfilled, people who have overdone it? And I really think there's kind of two reasons. Of course, there's patients who seek that out or providers who just overdo it, whether that's due to inexperience or maybe that's the aesthetic they think looks great when in reality it's not. I also think there's been a misunderstanding of, the duration of fillers.
That's right,
really how long fillers last, because, particularly with our aesthetic patients, they get really trained and used to coming in on a regular basis. They love our appointments. They want to come in. And the first thing when we do a great job, they get a great result. They're like, all right, when do we do it again? Because I want to keep this, right? And that happens all the time with fillers. Say we do a great job and they say, when do I need to redo it? You do their lips, you do their cheeks. And often providers are looking at the makers of these filler products for guidance on how long these fillers last.
Right.
And in reality, the companies that make it are limited about advertising the duration of these filler products dependent on the original clinical study. And so we do a lot of filler studies, and traditional filler studies are only a year-long study. There's a few filler studies been 2 years. So if you look at all filler duration, it's either 2 years, but mostly a 1-year duration.
Right.
But if you look at the data, at 1 year when those studies end, a lot of patients still had that result.
Yes.
And so I think these fillers do last a little bit longer than what the companies are able to advertise. And that's not a bad thing. I think that's a great
thing. You're saving
thing.
money. But you're right. We used to say, come in every 6 months or every year for your filler. But now we know we have a lot more data. That it lasts much longer.
And you know what? I still have my patients come back every year or every 6 months. And instead of saying we're going to do this exact same area again, I say we're going to take photographs and decide, is that area holding? Because there is a wide variation with filler, how long it lasts between individuals.
Yes, and the type of filler too, right?
Because traditionally the way I think about fillers, the way they go away is there's mechanical movement, like the movement of our face can kind of enhance the mechanical degradation, and then there's the enzymatic degradation. So these fillers do go away, particularly the hyaluronic acid fillers. We do have a enzyme that our body produces that breaks it down, but the activity of that enzyme between individuals can vary. So some people can chew up filler pretty quick. Some people it lasts a long time, and we can't predict that. The only way we can predict that is looking at photos. So I reassure my patients that, yes, the goal is never to overdo it with filler. But fillers are safe, can be done great, and it's so nowadays I'm educating my patients a lot more on fillers and the duration and how often we do it and avoiding overdoing it. than we have traditionally in the past, which is interesting. Yeah.
And there has to be a reason to do filler, right?
Yeah.
You just don't go in and say, oh, I think I want to make my chin, bigger or my jawline bigger. Well, I don't think patients know that. They should be evaluated and seen, to determine where to place the filler.
Yeah.
I feel like a lot of people just come in wanting jawline filler, for example.
Exactly.
But, then you evaluate them and you're like, no, that would, not be a good look for you because it would just throw off the facial balance and so forth. Okay, quick pause here because I have to share this. I started AussieMD Skincare after seeing so many of my patients spend hundreds on miracle products that didn't actually work. I wanted something different, science-backed, clinically tested, and designed for real results. But here's the best part. Our products are multifunctional, so you don't need 10 different steps and products and 15 bottles on your counter. Everything is layered and comprehensive, which means your routine is simpler but way more effective. It's skincare that actually works to change your skin for the better. So check us out at AussieMDskincare.com. That's AZIMDskincare.com.
Yeah, because we always want to make natural results, and really, what with filler, we're trying to replace volume that traditionally we lose with age. Of course, there's younger patients who have like deficient areas, maybe naturally have a small chin or small lips that we're trying to enhance. But traditionally, we're trying to restore, I like to say, a youthful facial shape, and that's where the assessment comes into play. And everyone wants a natural result for the most part. And so that's what we're trying to deliver. But it is interesting. Sometimes patients, notice an area that's deficient, but then they say they don't want filler, but there's really no alternative. Then they're like, well, why can't you do
PRF?
But these aren't PRP. But those aren't really volumizing agents.
No, they're not volumizing.
So they're like, well, they're just picking something else that I had. It's like asking me to, fix their car with a toothbrush. You can't do that.
Right. Yeah, it's a structural issue. You lose volume, you have to replace it, and that's where it comes into play. I get a lot of people coming in and they say, well, I want that that natural PD or PRF, easy gel sort of that natural filler, but that there is no, hyaluronic acid is natural, right? Yeah. It's found in our own
I actually tell my patients when they say they don't want filler, they want a natural filler.
Yes.
I say the most natural filler would be fat. So you could do fat transfer, but fat transfer is a more involved surgical procedure. You have to get your fat from somewhere else, more invasive. You put it in, and it's a little bit more unpredictable because that filler and that fat has to survive that transfer.
Yes, it's a graft, really.
It's a graft. You're moving it, so there's unpredictability on results. And if it doesn't turn out great, it's there forever.
It's not.
So I say that's the most natural option, but it's more invasive, it's unpredictable, and it's not reversible. Where we have these great options, hyaluronic acid, you mentioned, is a natural component of our skin. So to me, those are very natural, and all the other benefits of, it's long lasting, but not forever. It's reversible. So there's so many more pros than the most natural filler, which is fat.
Yes.
Yeah.
And so, when done right, fillers, do you find them to be safe long term? A lot of my patients worry about, damaging the skin. Migration of fillers is a big topic they're worried about. If you put it here, is it going to migrate up to my temple, or is it, what are your thoughts on that? Filler migration, long-term safety.
So long-term safety, I'll start there. A lot of these products have been around for a long time. So, the first hyaluronic acid-based product, I think, was FDA approved in 2006. Some of the collagen stimulating fillers, even earlier, 2004, I think, 2002. So we have 20 years of long-term data. If there's any kind of scary long-term side effect, we have seen it by now. And actually, hyaluronic acid products have been used even before that for other medical purposes, whether orthopedics for knees. So we have long-term safety data regarding these products. In terms of migration, that goes back to, amount of product and location. So when we're injecting these fillers, we're injecting it actually below the skin in our fat pads. And these fat pads are well defined. A lot of anatomists over the past 20 years have really defined these facial fat pads. We have superficial fat compartments, we have deep fat compartments, and filler cannot kind of push through kind of these collagen-based, septae or separations. So they will occupy the space that they're placed in. And so there are certain areas or certain fat pads that are fairly large and broad. So if you end up injecting these products too superficial or putting too much in, it will occupy that whole space and may look unnatural, look like it's moving out of the intended area because it's been injected in the wrong location in wrong amounts. Common areas we see this is lips. So the lips, if you keep overfilling the lip, if it's not anatomically structured to hold that much product, it's going to migrate or move. It's going to follow the space into your cutaneous upper lip. In the tear trough area, if you're too superficial, not below the muscle, there's a large kind of superficial fat compartment, so it can start moving down to your lower cheek. So it's not necessarily migrating, it is occupying the space it's placed in. And so migration, I find, is more of a problem of amount of product in the wrong location, and then it can occupy spaces where it wasn't intended to be delivered to.
Right. And, the word filler is such a generic term because they all have so many different types of properties. Some of them are, more likely to move. Some of them are ones that draw water in, and they're, more hydrophilic. So I think it's also important the type of filler you choose for each location is also really key. So I think going to somebody who really knows how to inject the techniques, and they've been doing it for a while and really has your best interests at heart. I agree. Very safe and long term. So what if it stays around long time, right? And that's actually a good thing when it comes to fillers.
No, exactly. I mean, we've been getting great results. I always tell my patients, you're seeing patients when you go online and seeing bad outcomes. You're seeing that rare kind of small subset of patients that have been too much product, wrong location, wrong product, all those decisions, but you're not noticing all that great work.
Yes.
And we talk about these celebrities who get great work, and no one really knows. They're not really disclosing.
Exactly.
Is it just injectables? Is it surgery? It's all the above.
All the above.
And people desire that look. There's a reason why people are coming into our offices, because we're able to deliver great results. But then they get skeptical of our recommendations. And so, that's partly education. That's partly sharing your work and showing our before and afters, and going to experienced providers who really know what they're doing.
Yeah. So let's switch gears a little bit and talk about some other types of injectables. I know that, a lot of people are asking me about salmon sperm DNA, the PDRN, the ribonucleotides that are being injected, exosomes. There's, biostimulators now that are coming into play. Are you utilizing any of these in your practice for facial rejuvenation?
Yeah. So the question is, why are we hearing about these kind of regenerative products? Well, there is a interest in our patients to do more natural things that stimulate our cells to kind of act more youthful. And there is some data coming from overseas, particularly in Asia, where you're hearing more about the salmon sperm, the PDRN, exosomes. And these are kind of potential cellular signals that we can place into the skin and the body that can activate our cells to start behaving more youthful. So that's the whole premise of why we're hearing about it. And there's a good kind of mechanistic or potential scientific rationale. Where I think we're lacking right now is kind of the true in-human clinical evidence that these things actually create an effect. There's a scientific rationale, but it hasn't been shown clinically. So I've been hesitant to jump on that, particularly with injecting these products. When you're injecting it, you're delivering it to the body, and they have not been well studied to be injected. These are products being made overseas. You don't, maybe the active ingredients there, but there's so many other carriers. There's often a gel or a liquid-based carrier to stabilize these molecules. We do not have a clear understanding what's in it. So I've been very hesitant to inject. Now, there is some idea of placing it topically, which is safer, where it's just absorbing into our superficial skin and may have more of a kind of a skincare benefit. That's where we're exploring. I'm not injecting it until we get more scientific data.
Yes.
And it has to get FDA approval to actually inject something. You're delivering, and you're delivering that is a drug that you're a drug or a device, and you need FDA approval. And these products are coming to the U.S. with just a cosmetic topical application, and then people are then injecting it.
Yes, I don't think people realize that. I think as dermatologists, we study the skin so in depth that we know that it's very immunogenic. Like, these are foreign things that are not regulated by the FDA, at least in this country.
Well, and also when there is a product being injected, they look at every single ingredient, not just the active ingredient. So say you have a PDRN product, and every company may have a different PDRN where that's the active molecule, but that molecule has to be stabilized and be in a solution or a gel-based product that delivers it. and often some of the bad outcomes are due to not the active ingredient, to the other kind of delivery or stabilizing molecules that are in it. And when these products are not intended to be injected, or not, at least right now, studied for injection, they're using products that are not necessarily intended to be delivered into the body. So you can see bad immunogenic reactions, granulomatous reactions,
right,
where your skin kind of reacts to it. So for all those reasons, I've been very cautious. I'm intrigued. I think there's a good scientific rationale, but just, as a scientist myself, like, show me the data. Let's get some good clinical trials. And those trials really are to protect, the population.
And long-term trials. I mean, we know that you can inject something and be fine for 6 months, and the next thing you know, a year from now, you can get reactions that are delayed.
Yeah, and and we know how our immune system works. You can you can develop an allergy over time, so with subsequent exposure. So you might have 2 or 3 times where in the injection you had no reaction, and then everything lights up with that next injection.
Yeah, I agree. What about Sculptra? Are you a fan of the biostimulators?
So
or
I love biostimulators. We use a full portfolio of dermal fillers. For gel-based, hyaluronic acid-based fillers, I like it to really kind of augment specific areas. For the collagen-stimulated fillers, those I typically use in patients who have kind of diffuse volume loss. That's common kind of, patient that I would see is, that starting in the late 30s to early 50s, very athletic female who has kind of pan facial volume loss. Temples are getting hollow, the lateral cheeks. And so we need to add volume throughout the face, but we don't want to overdo it and make them too puffy to get that kind of facial overfilled syndrome. So those collagen-based products, whether that's Sculptra or hyperdilute Radiesse, are great options.
Do you have a favorite? Is you use one more than the other for kind of a pan facial volume loss?
I use both. It depends on the patient. If the difference is Sculptra is just that collagen stimulating. It's kind of slow build over time, whereas Radiesse has a collagen stimulating effect, but in itself the gel occupies space, so it's not diluted in water. So there is a filling effect even when you dilute it down.
Right.
So someone who has a little bit more soft tissue that has panfacial volume loss, I'll skew to Radiesse. Someone who's very thin skin, you want to slowly build up your time. I skew to Sculptra.
Yeah, I think Sculptra also does a great job of thickening the skin. Okay, quick pause here because I have to share this. I started AussieMD Skincare after seeing so many of my patients spend hundreds on miracle products that simply did not actually work. I wanted something different, science-backed, clinically tested, and designed for real results. But here's the best part. Our products are multifunctional, so you don't need 10 different steps and 15 bottles on your counter. Everything is layered and comprehensive, which means your routine is simpler but way more effective. It's skincare that actually works to change your skin for the better. So check us out at AussieMDskincare.com. That's AussieMDskincare.com. You're lecturing on male aesthetics, and is this something you seeing a lot more men coming in and doing procedures?
So I'm doing a couple of male aesthetics. I'm lecturing on body contouring, the new body contouring devices, as well as new patient assessments, how to evaluate a patient. But in terms of male aesthetics, this has always been an interest of mine since I was a dermatology resident. It started out as personal interest. So it was like, because often when I won't say how long ago, but when I was in training, a lot of the photos and BNAs of treatments were on females, which was the natural market. But so men occupy right now around 12% of non-surgical aesthetic procedures.
I thought it'd be more.
It's been in the 10 to 12%
range
range
more
for
like
12 years.
30 or 40. But
it's been kind of growing with the female market. I guess where you see more interest in that, and this is something that's part of my practice. I treat a lot of hair loss and do surgical hair restoration, and men are more attuned to the hair. So my personal practice, I see a lot more men than the nation average, because I'm doing hair loss as well as non-surgical aesthetics. But men are interested. They're just kind of interested in different things. I always like to describe there's kind of 3 main areas of a face that men kind of worry about. It's their hairline. So there's hair loss.
That's a big one.
Changes in their eyes. So it's, a common refrain I hear from my male patients is, I feel like I look tired. When I hear that, it's like the periocular changes. They're getting kind of tear troughs. Their eyebrows are sinking down, and then changes along the jawline, right? So they want kind of that sharp masculine jaw. They want to not look so tired in their eyes, and they want to have hair. That's the way I think about it. Less concerned about cheeks and lips and those things, which are traditional areas for filler, but they're very interested in filler for the jawline. They're very interested in using neuromodulators to open your eyes, filler around the eyes, tear trough filler, and then of course kind of restoring the hair. So that's where I treat and see a lot of my male patients.
Yeah. What do you think of the new cure for baldness that just came out of UCLA? Is it a peptide that they're using? The P35.
Yeah. So I want to hear more. Yeah. So it was preliminary, like phase 1 data.
Like
yeah. Very exciting.
Like hairs that we thought were gone.
Yeah.
They're bringing it back. And
so, the company, rightfully so, is holding a lot of the intellectual property. So I'd love to see true mechanism, how it works.
Right.
And now it's kind of phase 1 data. So as it moves to phase 2, phase 3, if that pans out, that could be a blockbuster.
Wow. If we could cure baldness, it's got to happen in our lifetime at some point.
And
right?
which is great. There's a lot more interest in hair. Hair has always been kind of like within aesthetics. It's always been kind of like the forgotten child.
Yeah.
Even though men, women, so many people are bothered by it, but I think a lot of, at least within the pharmaceutical industry, there's been a lot of companies that have tried to go after that space and kind of failed. But now we're seeing some success. There's actually another company currently in phase 3 with a new oral medication that's shown very promising results. So we may, I'm encouraged that we will probably have a lot more options, both medical and potentially procedural to treat hair in the next 5 to 10 years.
Absolutely. What is your go-to like for hair restoration? Is there a cocktail that you tend to use together?
It depends.
Like
it's like everything else. Yeah. So
minoxidil?
I like to say there's medical therapy, there's regenerative therapy, and then there's kind of surgical. How aggressive I get with the patient depends on the patient's severity, but also the motivation of the patient. Some patients are looking not to restore all their hair, but to just stop or slow it. They're not that motivated, so they will skew just kind of down the medical track. And the mainstay for me is starting at least on trying to get them on oral minoxidil. The oral form of Rogaine, I think, is really changed my practice over the past 5 to 7 years. As well as potential oral anti-androgen, whether it's spironolactone or finasteride. On the regenerative side, there's PRP has been a mainstay in my practice for a long time. We get great results with that, but they're encouraging new kind of products potentially down the pipeline. Platelet-derived growth factors and new buzz in the aesthetic industry.
Are you injecting that?
We're not injecting for hair, but we're very interested, and we may be starting a clinical study. So that's something that we're interested in exploring. And then on the hair restoration side, that's a booming part of
hair transplants.
Hair transplantation, surgical hair restoration. A lot of times people are going overseas, but even within the U.S., people are getting these procedures, and we particularly use a robot that can help really carefully dissect.
Robots?
Yes. So
you use robots to do the hair? So
robotic hair restoration, where the robot can actually cut out the individual hairs one by one and then help you place them. So that is something that's been a part of our practice.
Very cool. We'll have to come visit and take a look at that. That's very neat. So thank you so much for your time. I just want to finish up with doing some rapid fire if you're up for it.
Let's do it.
Okay. So first one, research lab or lecture hall?
Ooh, it's a tough one. Research lab.
Okay. Coffee before rounds or tea?
Coffee.
Okay.
Cuban coffee.
Black or with milk?
With oat milk.
With oat milk, okay. Farmer's market or grocery store?
Farmer's market.
Beltway traffic or public transportation?
I like to drive. I don't want traffic if I can avoid the beltway traffic, but I can drive. I prefer driving than public transportation. I don't mind driving.
Shaving cream or shaving oil?
Laser hair removal. So this beard, I have lasered off all the hair around it. So my beard is perfectly shaped because I don't have to shave it. I just have to trim it when it gets too long.
Oh, nice.
Yeah, so laser hair removal.
That's how dermatologists do it. We plan ahead.
Yeah, beard shaping, as I call it.
SPF 30 or SPF 50?
50.
Okay. And what is an early career lesson that shaped you today? Do you have anything?
Yeah, so my mentor, I trained at the University of Miami in Miami, Florida. And the first day of residency, he said, become an expert in something. It could be, seborrheic keratosis or sebderm, like become an expert, because in the derm is a small field, and we have so many different diseases. You really can become an expert early in your career, and I was fortunate out of residency to start lecturing and publishing. So become an expert. And number two, that's for residency, but then kind of early professional, like once I finished residency, he also told us when we first get out there, don't say no to anything. So say yes to everything, especially early in your career when you're trying to get out there, particularly if you're interested in just beyond the clinic. If you're interested in evolving with industry and being involved in studies and great meetings like this. And so, I always say yes to everything now with a family of three kids now. Sometimes I say no every once in a while, but that's still kind of always in my back of my mind is
that's great.
Never turn down an opportunity, because you never know.
You never know what that might lead to, and you kind of learn more about yourself and what you're good at and so forth, especially when you're first starting out, because you really you're not sure what path you're going to take.
Exactly.
So well, I love that. This was so fun.
Great.
Thank you so much for joining me. And can you just let everyone know where they can find you, your website, your social platforms?
So Terrence Keaney, I'm a dermatologist, and I was founder and a director of Skin DC. We're in Arlington, Virginia, so right over the river from Washington, D.C. Our website is skindcderm.com, and you can get me on Instagram at Dr. T. Keeney.
All right, guys, you are more than just a pretty face. Remember, you're educated, you're empowered to make the best decisions when it comes to treatments and products for you. Until next time, bye, guys.